Hello, my name is Pamela Powers Hanley and I'm the social media editor for the American Journal of Medicine. I'm here today with Dr. Joseph Alpert, who is our editor-in-chief, and we're going to talk about an article in the current issue. This one is about hospital readmissions following the change in the physician call system. Dr. Alpert, what can you tell us about this?
Yes, Pam, we've had a lot of problems with the duty hour changes. What it requires is that there's almost every day a different resident seeing the inpatients. Of course, this creates a lot of confusion, and many of us are very dissatisfied with it. We think it also interferes with the educational process compared to what we had before this, what I call the resident merry-go-round occurred. And so we're starting to see studies of this to see, has it made any difference? The hope was it was going to reduce errors and that it was going to result in house officers being better rested and more capable of learning. However, many of the articles, including this one, have shown the opposite. That is, it's detrimental both to the educational system and to patients.
So there have been many controversies since the change in duty hours. Could you tell us a little bit about that and also the take-home message of this article for physicians?
Well, this article, which is, I said, one of a number that have come out recently, points out that after the duty hour change with the merry-go-round introduction, in fact, patients are much more commonly readmitted. It ended up in thousands more patient hours in the hospital, and of course the expense related to that, and of course the psychological and physical impact on the patient of having to be readmitted to the hospital. So that, and it's no surprise, because with a constantly changing team, you're constantly having handoffs, there's lots of opportunity for error to enter into the communication and lack of real understanding of how the patient's doing, because the individual who's seeing the patient hasn't seen them the day before or only very briefly the day before. So unfortunately, there's been no improvement in the error rate, the failure rates, and now this article says there's an increase in readmissions. So in fact, not only has the system failed to improve things, it's actually made things worse. So I'm a strong advocate for returning to our former system, requiring no more than 80 hours of work a week and being on every fifth night for 24 hours. That system allowed lots of time for residents to recover from the 24-hour stint, and there was much better, intense coverage of the patients. This has been a very bad move that's been made, and we're all hoping, all of us in academic medicine, I'm not alone, in hoping that there's a return to a previous schedule. Thanks so much for being with us today on the American Journal of Medicine Information System. You can see us both on YouTube, on Facebook, on our website, and on our blog. Please tune in. There's a lot of interesting material there, and we look forward to having you read us and contact us.